Hello, everybody. My name is Ricardo Cabrera, and I am the operations manager here at the Latino Chamber of Commerce of Boulder County. And today we have as our guest, Stephanie Salazar Rodriguez. She is the Latinx Communications Outreach and Engagement Consultant for Connect for Health Colorado. So, Stephanie, welcome. How are you today?
I'm great, Ricardo. Thank you so much for having me. I really appreciate the opportunity to be able to talk about my work today.
Excellent. Thank you. Well, before we start with work, why don't you tell us a little bit about yourself?
Okay. I'm a second generation Latino slash indigenous with roots to the Taos Pueblos in Colorado. My family has been here for over 100 years. I have a master's in public health and a master's in nonprofit management. And I work as the Latinx community outreach and engagement consultant. And I also have a small consulting business called Blazing Cloud Consulting, where I'm doing training and technical assistance in public health, including health equity and inclusion.
So if other groups see what you're talking about today and that you're an expert in your field, they can call you back and you can consult with them.
Absolutely. And I strongly encourage that.
All right.
And I even talk to people to let them know exactly what I do. And if they have any work for me, I can work with them on whatever basis that they feel. I have really been really trying very hard to meet people where they are as far as their budget goes. But I also work, do some contract work. So I really, really would, absolutely love the opportunity to talk to people about both Connect for Health Colorado. That is my primary reason why I'm here today. But that's also how I got into Connect for Health doing my consulting work.
Excellent. Cool. Well, so let's talk about Connect for Health Colorado. What is Connect for Health Colorado, or who is it?
Yeah, Connect for Health Colorado is the state's official insurance marketplace. It is the only place where you can go to get financial assistance to help lower your monthly insurance costs. We have representatives throughout the state. We have bilingual experts that are working in Colorado. We are working primarily with two of the groups in Colorado, which is Servicios de la Raza and the Aurora Community Assistance Network, to work with people who need someone who is Spanish speaking. But we have health coverage guides throughout the entire state of Colorado that can help you to be able to get information about health insurance coverage.
So we're in Boulder County, and the Latino Chamber here is Boulder County. So where would I go to Boulder County to find out about this or get help?
Well, right now, because of COVID, we're doing everything virtually. So you don't have to worry about having to go somewhere in person. You can go and you can call someone, or you can also go to the Connect for Health website, which is connectforhealthco.com. But I have two phone numbers that I can share with you. The first is for Servicios, which is 303-953-5949, or Aurora Community Assistance Network at 303-923-6519. And in Aurora, they also have other languages that they speak as well. But primarily, since we're dealing with the Latino Chamber, we're talking about English and Spanish. But both of them have bilingual help that can help you at any time.
Yeah, that's good. So I'm going to put all that information down here in the description. So Perfect. If anybody needs to get those numbers, don't worry about writing them now. They're going to be down here. And just to add on that, in Boulder County, they have a service called language help or language leap, something like that. And it's Language Line. And what they do is that they take any language. So they do have individuals, live in-person individuals that speak Spanish and English. But if you speak any other language, all you have to do is say so when you call, and they will find a live interpreter within seconds. It's really not that difficult for them to get a third party in there to interpret for you. So language is really not an issue in Boulder County. I'm sure other counties have that as well. So Stephanie, so you called, you have somebody on the line, and you're going to get financial help, and you're going to apply for health insurance online with these people on the spot. Is that how it works?
On the spot, you will have somebody that you talk to, and they will open up their computer and ask you some basic questions to find out whether or not that you qualify for the health insurance and or financial assistance. So I have even done it myself, and it takes, I would say you would commit about 30 minutes to it. And if you are unemployed, they will also help you get on Medicaid. So it's not just private insurance. They will help you complete the application, and whatever you would qualify for, that's what they would help you get into.
Yep, and Medicaid, of course, is the state health insurance. That is, if you qualify, then it's at no cost to you, and you're still covered.
Exactly, right.
For
And that's
medical
people who
insurance.
have low to zero income that would qualify for that. And some people may qualify, their children may qualify for that, or for the chip for their children. And so it's real important when you talk to somebody, they will let you know all the options that are out there.
Okay, so tell me a little bit about the health insurance itself. I mean, health insurance is medical, it's doctors, it's eye doctors, it's, what do you get? I mean, what else do you get? For those who don't know.
Yeah, well, there's a lot of different plans. They have them, they start with the bronze plan, a silver plan, a gold plan, and that's based on what type of coverage that you would like to get. And the higher the coverage, you can go all the way to platinum. That means you would pay a higher insurance premium, but you would have better coverage. So they also do have dental insurance, and they also have vision insurance that they could help you with as well. So it's not just medical insurance.
Okay, and I'll have to throw in the idea of the HSA medical program, which in my mind is the hidden gem of all medical insurances, especially if you're a healthy individual or if you're not. Can you tell me a little bit about what that is and how it works?
Well, it's a health savings where you would be able to put money into a savings account that would go toward your health, whatever the costs were. It could be for what you put out of pocket. It could be for your prescriptions. It could be for eyeglasses. And so a lot of employers offer that as well. And generally speaking, that would come with one of the lower cost plans that they have through the health exchange. And generally that would be a bronze plan.
Right. So just to add on to that, the HSA is still a medical insurance, and it's known for two things. It's a monthly lower, so it costs less every month. If you're a healthy individual, this is ideal. Or if you have a high medical cost too, because you do pay less every month, you have a higher out-of-pocket, like $6,000 per individual a year. But after that, the insurance pays for everything, 100% of your costs. And you get the benefit of the health savings account, which is like it's a tax deferred, it's a pre-tax money health savings account, kind of like a 401k for employees, where you can put in up to a certain maximum amount of money every year, and you can spend it for whatever you need, that as long as it's medical expenses for the rest of your life. So you can fund it while you're making a lot of money and spend it when you're not making any, and so on. Anyway, I'm a fan, if you can't tell, of an HSA. So there you go.
And that's why there's so many different options available for people. It's not just one thing, and one thing doesn't fit everybody. Everyone has different needs.
Yeah, and therefore you talk to your consultants, and they'll help you guide you where
exactly
your best fit. Absolutely. So, okay, very nice. So just to clarify, when you're talking about ADA or Connect for Health, this is the Obamacare. This is what also is known Obamacare, and you can go in there and find health insurance through federally funded programs, right?
Yes. When the Affordable Care Act, and some people call it Obamacare, was passed many years ago, the government allowed different states to either buy into the federal plan or to each to have their own marketplace. And Colorado chose to have their own marketplace, and that's how Connect for Health Colorado came about. So there are definitely some federally funding behind it, and and that's why it has so many different options for people. But Colorado was in my opinion, they were very astute in realizing this, because that's how we were able to expand Medicaid as well. Many states did not expand Medicaid. So we have many more people who couldn't afford health insurance and qualified for Medicaid, and now have health care coverage.
Excellent. So it used to be, I don't know if it's different now, that when you are getting insurance, you have a window of time during the year to register. Is that still the case?
Well, that as we're getting into, that I was going to talk about that in a different question. And normally it's called an open enrollment period. And normally it goes from November through January. But this year we've had two extensions. The first one we'll extend it through May. And now, because President Biden recently signed the American Recovery Plan, people who are still unemployed now have the opportunity to enroll for health insurance all the way through August 15th of 2020. So now we have several more months that people can go in and they can apply for health insurance.
All right, of course. And of course, this is if you already had insurance, you have to like renew it every year during this time. If you're new and you've never had insurance, you can still sign up anytime. Is that correct?
No, that is not correct. If you're new and you haven't, you still have to go through the regular open enrollment period unless you have a life-changing event. For example, if you lost your job, or if you got, if you were someone that was had turned 27, because up to 26 you can be on your parents' plan. So if you turned over 26, that's a life-changing. If you had a child, if there was a death in your family, if you got married. So all these things are called life-changing events. So during the life-changing event, you have up to 60 days after that life-changing event, and that can be any time throughout the calendar year. But otherwise, if you're brand new to it, you have to go through the open enrollment period.
Gotcha. So note that you have to register when you can, otherwise you're out of luck for until the next time.
The next open enrollment period, absolutely.
Right. Okay, so Stephanie, let's talk a little bit about something that's unrelated. You mentioned the American Recovery Plan. This is President Obama's new medical, or tell me about that.
Biden.
Yes, thank you, President Biden. So tell me about that. It's unrelated to Connect for Health, but it's got some nice things, right?
Right. Actually, there are a number of really great things that are going to help people. And the number one thing was for people to be able to get to enroll in health insurance till April. But the other thing that has happened is that under the American Rescue Plan, individuals who may have received unemployment benefits at any time in 2021, and if they meet the other requirements, then they will be eligible for a free year of health insurance through Connect for Health Colorado. So anyone who has gotten unemployment insurance, and they may have been on another plan in the marketplace prior to this, but after April 15th, then they would reapply and they would be eligible for the full year of health insurance for free. And in addition, one of the other points that has done is that the people who are on COBRA insurance, and COBRA is the insurance that you would get from your employer once you leave your employer if you don't get insurance anywhere else. And that can be very expensive. So under this plan, it also allows for people to receive 6 months of payment from the government for COBRA. And that could be up to $6,000, or I mean, up to that. For me personally, I was laid off from my job, and so I am getting assistance for 6 months as well through COBRA, which is for me close to $6,000. So these are some really great things that they have done in order to help people get coverage through insurance.
Wow, that's awesome, Stephanie. So remember, guys, all this information or contact information will be down here in the description of the video. So thank you for listening. Stephanie, this is great information. Do you have anything else you want to add?
Yeah, one other thing is that, as I stated earlier, this is a statewide program. So there are experts that cover this all over the state. You can get help in almost any language that you need. And you can either call the numbers that I said earlier and that you're going to have on there, or even go to the connectforhealthco.com and get assistance there. So we're really eager to get more people eligible for health insurance, because in my opinion, this is a right and not a privilege.
Excellent. Well, thank you for that. So before we go, Stephanie, I have a surprise question for you.
Okay.
Are you ready?
Ready, drum roll.
What is your favorite word?
My favorite word?
Yep.
Comida.
Yes.
That was just off the cuff. Which is
I love it,
word,
baby. Yep, that counts. Excellent word. So thank you, Stephanie, for everything. And until next time.
Thank you.